My name is Renee Mahaffey Harris, and I am the President and CEO of the Center for Closing the Health Gap. We have a grassroots mobilization model, and that model is built around three core components, where we're engaging the very people, as well as many stakeholders from policymakers to corporations to schools to businesses, to be a part of engaging around the issue of health. Lead the efforts to eliminate racial and ethnic health disparities throughout Greater Cincinnati, to empower individuals around their own health. Creating the type of solutions that they want to see in addressing their health.
We try to have some type of activity at least once a month, depending on what it is, and we try to partner with Closing the Health Gap as much as possible, because we know together we can definitely bridge the gap. So if we're having a night, if we're having an academic night, we sit down and we talk about ways that we can have more than one activities going on at night. It can be a family night. We do a lot with food and eating also, where we sit down and we talk about different ways that we can feed our babies. This is what's unique about the Gap and Do Right. So we try to find ways that we can feed our babies and have them something that's healthy.
Some people think that it's hard to eat healthy and expensive to eat healthy, and it's not, and they showed us a way that we can eat healthy without having to spend so much money. This program is important to me because I have a child that got type 1 diabetes. So I just really appreciate somebody spreading the word about disease prevention and health and nutrition.
As a physician and as a public health professional, it became starkly apparent to me that there was a need in the African American and low-income communities for us to address the health disparities. I saw that and knew if a people are hungry, you can give them fish and they'll eat today. If you teach them how to fish and teach them how to make their own fishing rods, they can eat forever. Giving people the tools, the information, so that they can teach someone else in their family to pass the information along. The Do Right campaign was a program to get neighbors reaching out to neighbors to bring them into a setting where they could get information to help them help themselves.
We went door to door, providing information for residents about what we were about. So you meet those actual residents who live in the neighborhood. And what brought the impact of that home, that we go door to door, that we know they're the neighbors, that they trust us to give them good information, that they trust us, that this initiative has helped me, it can help you, I'm gonna bring you along. And you get to see people who actually really care about their neighborhood, who really want to be a part of anything that's going on in their neighborhood that's helpful.
I can't think of anything that's more important than one's health. I felt like I wanted to do something about it. We went to work. That's what we've been focusing on for 16 years. To me, that's really where the fundamental change takes place long term.